Hello, welcome to the EDS Educational Series webinar. My name is John Furman. We're pleased to present a new topic in our series of educational webinars. Eloise, who is a licensed massage therapist with advanced training and diplomate certification in CranioSacral therapy. As in the past, these programs will be recorded and posted in our library of EDS Awareness Educational Series webinars. That's Chronic Pain Partners /webinars. These sites will also be available to download from the site where you registered for the program. We'll be sending out an email and letting you know when those are posted on the site. So before we introduce our speaker, I'd like to give an overview of the free EDS awareness programs. There will be opportunity for Q&A at the end of the presentation. You're welcome to ask your questions at any time by clicking the Q&A button on your panel. Please use the Q&A button and not the chat. We had a problem last time where we had people putting questions in both. So again, my name is John Furman. I manage the National EDS Awareness and Chronic Pain Partners nonprofit organization based in Cincinnati, Ohio. Our mission is to connect, support, and educate patients, caregivers, and healthcare providers about Ehlers-Danlos Syndrome and associated conditions. My daughter, Deanna, who's diagnosed with hypermobile EDS in 2008, the same year my wife Carol passed away with breast cancer. I was a caregiver for my wife who struggled with undiagnosed EDS for over 30 years. Deanna and I introduced our program in 2012 to help EDSers form independent local support groups and spread EDS awareness and education in the communities. We've been a sponsor for many EDS conferences and events over the past 8 years. We provide a variety of resources through our programs. We've helped to start and or support 120 groups to date. Each group is given their own free website with a link from the directory and map. Most groups are in the US, but we've helped to start groups in Alaska, Australia, Canada, and in the UK. We recognize that it's very difficult for those with a chronic illness like EDS to form support groups and start them and manage them. So in May 2019, EDS Awareness Month, we conducted a day-long live stream program for existing and potential support group leaders. Topics discussed included starting and managing adult and children's support group, advocacy, and the safe use of Facebook. Our special guest was Mandy Harvey, who is an award-winning singer, songwriter, and inspirational speaker, who lost her hearing at the age of 19 from EDS. Listen to her share her story and her beautiful songs. We received feedback from support group members that conferences provide valuable information and social opportunities, but many cannot afford physically or financially to attend these in person. So we decided to bring the speakers to the members through the free EDS Awareness Educational Program. We have over 100 webinars covering over 50 topics posted on our webinar page. You can locate them by presenter's name, topic, location, and specialty. Click on the section to the right and you can get on our email list for upcoming webinars. Most of our webinars relate to general conditions that many of us can encounter, like sleep disorder, pain management, nutrition, biofeedback, physical therapy, and exercise. Our members told us that someone needs to start training the doctors. Our healthcare providers educational program was introduced in September 2017. It provides free continuing educational healthcare provider programs that they need and certificates they need for renewing their licenses. Is receiving an overwhelming response from the medical community. We've had participants from over 40 different countries. This is the first 724 online EDS course providing CMEs, CNEs, and CEU credits. It covers the diagnosis, classification, treatment of Ehlers-Danlos Syndrome and associated conditions. Any patient or healthcare provider interested in learning more about EDS are encouraged to view the presentations, whether or not they desire the certificates. We know nurses spend more time with patients, so we organized a nursing advisory board to create a similar online EDS nursing education program. In January 2020, we introduced the free EDS awareness, EDS nursing educational program. This is the first, again, online course providing CNE credits and covering the fundamental principles of diagnosis, classification, and treatment of Ehlers-Danlos from a nursing perspective. Because of the pandemic, we haven't completed the program yet. We have 3 courses out there, but there are 3 more that are being planned. Please review and spread the word about these free educational programs. Just an aside, we've been promoting a new book that is available on Amazon. Disjointed is for patients with hypermobile EDS and the healthcare providers who treat them, with 21 specialists and 6 resource chapters. Disjointed brings together physician, patient, and parent perspectives to support the goal of early and more complete intervention and diagnosis. We have an outline of the book on our site. Please sign up for our new monthly newsletter. We just started this in May of this year, along with Karina Strom, and she's been doing a great job collecting information for this newsletter. So I've included a listing of links to the different sources that I just mentioned, resources I just mentioned, so you can get those off of this slide. So just a general disclaimer before we get started. This presentation contains general information about EDS and related conditions. Members of the EDS community voluntarily participate in these programs. The information is not advice. If you're having medical problems now, please call 911 or the emergency services in your location. Always consult your doctor before making any changes to your treatment. So we're very pleased to introduce our speaker for this evening, Eloise. Straighten. I'm going to give just a very general introduction, and she can tell you a little bit more about her programs when she gets into her presentation. So Eloise is a licensed massage therapist with advanced training in diplomat certification in CranioSacral therapy. She received her CST training through the Upledger Institute International, and holds certificates and as a teacher, assistant, and presenter with UII. And additionally, she is a founder of the Connecticut Zebra EDS and related CTD support group. Eloise has defined and refined CranioSacral therapy, treatment, protocols for those with EDS and hypermobility, and continues to derive new techniques and adaptations for each of her clients. She has spent several years researching, practicing, and implementing craniosacral therapy techniques to specifically address the unique qualities of people with EDS. She has a private practice in New Milford, Connecticut. It's a Connecticut Center for Craniosacral Therapy, where she offers craniosacral therapy as a treatment for neurological conditions, chronic pain, hypermobility, concussion, headache, and anxiety, to just name a few. So with that long introduction and my tongue tied there, I'm going to introduce our speaker for this evening, Eloise Steger.
Hi, John. Thank you so much. Can everybody hear me? So as I was saying, and John's nice introduction, I am a licensed massage therapist, and I've studied through the Upledger Institute and received my diplomate certification with them. They're based in Palm Beach Gardens, Florida. The program took me a long time to get through. So what we're going to talk about tonight is 15 years of practice and study and implementing adaptations, and then also throw in there the information on Ehlers-Danlos Syndrome and Dysautonomia pain, which in our family I come to directly. So 2 of my children have Ehlers-Danlos Syndrome. I have Ehlers-Danlos Syndrome, and my husband is a little weird and bendy sometimes. So my kids are getting it maybe from all sides. My husband and I, neither one of us are officially diagnosed, but our 2 children are diagnosed with hypermobile Ehlers-Danlos. It was my youngest daughter, Jackie, who helped found the Connecticut Zebra support group with me when she was 14, I think, who started to develop some really strange and unusual patterns in symptomatology, GI stuff, dizziness, pre-syncope, syncope, and then there is a major incident that led to cerebral spinal fluid leak, which didn't get diagnosed for about 9 months. And in the process of trying to figure out what was going on, also learned that she has Chiari and craniocervical instability. And we've now gone through 3 cerebral spinal fluid leak repairs with blood patches. She continues to have major GI issues that right now in this current time and place, we're dealing with on a day-to-day. A couple of appointments are coming up for her in the next week. We hope to get some clarity. So I come from a point of view as the mom, a caregiver, a therapist, a patient, a friend, a spouse, and I bring an interesting perspective to this because of that, I think. As far as my colleagues go, I've been slowly over time chipping away at trying to educate other craniosacral therapists. And so whenever I have a chance, and some instructors give me a little platform every so often to talk about it, I will talk to them in a class as I'm TAing about EDS. And right now, as a TA, what I'm finding is that the students coming into these craniosacral courses already have some knowledge of Ehlers-Danlos Syndrome, which 3 or 4 years ago, they did not. So the awareness in at least my circles, in my professional circles, is increasing, and I'm absolutely thrilled about that. In our study group, in our study guides for the courses, especially the first couple levels, Ehlers-Danlos Syndrome is being mentioned in our curriculum. So again, I'm thrilled that awareness in the professional setting in craniosacral therapy is increasing. John Furman helped me set up the Connecticut Zebras support group here, and we have a Facebook presence primarily. We actually have a monthly meeting tomorrow. Our group is primarily for people in Connecticut and the bordering states of family members and people with EDS. We have, I think we have over 700 members right now. And as founder, I am no longer leader. So our leaders are now Don Laughlin and Danielle Payne, but the three of us will admin the group. In addition, Danielle and Don and I actually recently founded another group to bring patients and all types of caregivers together, called the EDS and CTD's Coalition of Health and Wellness Practitioners. So if you wanted to look at that, it is a request to join process. And so we'll be looking out for you if you're interested. So tonight's presentation, I'm going to make an attempt to bridge this gap between pain and how it relates to the autonomic nervous system, and then how the structures in the autonomic nervous system and the techniques that we use in craniosacral therapy can they come together so that we can actually treat these systems. I am not going to attempt to go into all the minute details of craniosacral therapy, so I am leaving out quite a bit. I am not a dysautonomia expert, so I will not be going into the fine details of that. And I am also not a pain expert, although I have great understanding for pain. I'm not an expert in it, and so I will not go into finite detail in that either. But I hope that bringing some broad connections and parallels together will give everybody a basis for what craniosacral therapy is and how it can address their day-to-day or your day-to-day pain and dysfunction. Also, John and I have spoken that maybe if there's an opportunity at some point to go into more detail, there might be another presentation available, but we're in discussions on that. So how does this work? First, we need to understand that pain and the autonomic nervous system have a reciprocal relationship. And second, that structure and function have a reciprocal relationship. And it's this understanding that helps guide some of the treatment that I provide for clients. And pain in general for people with EDS, and I'm sure many of you guys are going to understand this, are headache, back pain, joint pain, and that can be acute or chronic, depending on if you've had a subluxation or an injury to the joint, and or widespread whole body pain. There's no one I meet with EDS who is not in pain. The problem becomes how best to manage it. So craniosacral therapy can offer non-pharmacological support for this. And pain can be present for a number of reasons, not only an Ehlers-Danlos thing. It happens in lots of conditions, but some of them can be just basic body stuff, is inflammation, an injury, reduced or increased range of motion. So we're used to increased range of motion, but when there's restricted or reduced range of motion, that can also cause pain. Nerve impingement or abnormal nerve responses, like in CRPS or fibromyalgia. Surgery, for sure. Sometimes surgery helps pain, but you always have that surgical pain. And then kind of important to me are what I call, and what other practitioners in my field might call, strain patterns. When you reduce a strain pattern in the body, it will reduce the pain. When you can improve the structure, it improves the function. You remember I said structure and function are reciprocal. Pain is registered, processed, and modulated through a cascade of information among the source of the pain, the nervous system, the brain, and then back to the source. So you have an injury, the nervous system feels it, sends the information into the brain processes and modulates it, and sends it back to the source. This triggers an autonomic nervous system response, and they have a reciprocal relationship. That means that pain and the autonomic nervous system trigger each other. The autonomic nervous system is controlled by and is a branch of the central nervous system. But the autonomic nervous system has three of its own branches. The sympathetic, or sometimes also called the fight or flight response. But I also have included freeze, faint, flock, flail, and fright. So all the F words. I'm sure there might be another one or two out there for your viewing pleasure. And the parasympathetic nervous system, which is our rest and digest system. Think sleeping and good digestion. And the third one is the enteric nervous system, which is all about the GI. It has its own nervous system, but that is way more than I have time to talk about. So we are not going to talk about the enteric. The sympathetic nervous system is in place as a life-saving neurological response to danger. It's in our system to run away from a threat or fight the threat if it were a lion or a saber-toothed tiger. But in today's society, our danger is kind of all the time. Every time we get into a car, we're on alert. And if you have EDS, sometimes every single time you get up out of a chair, you're in an alert response because you don't know if your body is going to hold you up. So blood pressure, heart rate, respiration increases. This is so that you have enough of the stuff you need to get away from the saber-toothed tiger. All the blood gets shunted to muscles, the heart and the lungs to provide the energy into those systems to run away from said saber-toothed lion or tiger. Your pupils and bronchi dilate so you can breathe and see clearly. And your digestion and peristalsis pretty much comes to a stop. In severe instances, the pain will actually decrease. You may have experienced a time when you've had an accident, maybe a car accident or something, and basically your adrenaline kicks into the point where your pain, you don't feel your pain until later. I know everybody has experienced that. So that's the sympathetic nervous system protecting you. So if we're under a true threat of a saber-toothed tiger, we might not really actually feel the pain at the time of being caught. I would hope not, anyway. All theoretical, of course. For people with EDS, I'm sure you guys see this on a regular basis as far as POTS and gastroparesis. POTS will cause us to kind of pass out sometimes or be dizzy and faint at other times. Our heart rate races, blood pressure can either stay the same or kind of tank. So there is there is a process where some things are turned up high and some things aren't. And that is the definition, really, of dysautonomia, when the nervous system isn't modulating properly. Parasympathetic nervous system is restorative. It's rest and digest. Blood pressure, heart rate, and breathing slow down. Think of sleeping. More blood is more evenly distributed throughout the body. Your pupils have a normal response. They're not stuck in dilation. And your digestion and peristalsis increases. Pain will decrease if you can maintain being in a parasympathetic state. Under normal circumstances, the autonomic nervous system functions appropriately. It responds appropriately to stimuli. However, the mechanisms of dysautonomia are poorly understood and they're still being studied. And as we know now in the news, other conditions will cause dysautonomia, like COVID is causing problems with that, which is helping to raise awareness of it at the very least. It's unfortunate that so many people are experiencing it, however. And it can also occur in conditions like diabetes and MS, cancer, and so other medical conditions can also cause dysautonomia. And when you are in dysautonomic states, most people experience the fight or flight mechanism. EDS will tend to be stuck there. And chronic pain will also keep the nervous system in sympathetic tone. So people with EDS who are often in pain are often in sympathetic tone. CranioSacral therapy helps to modulate the autonomic nervous system. Here's a little schematic that I made up. I don't know if it'll make sense. Made sense to me. So we have at the top CranioSacral therapy, or CST. We follow the pink line. That is the sympathetic nervous system. The minus in front of it means it's reducing. So with craniosacral therapy, we have a reduction of the sympathetic tone of the body. When we get a reduction of the sympathetic tone of the body, an increase of the tone of the parasympathetic nervous system happens. So when the sympathetic nervous system decreases and the parasympathetic nervous system increases, pain decreases. When pain decreases, function can restore. When function restores, the parasympathetic nervous system works better. Also, craniosacral therapy addresses function directly. So we can directly work with the function and the structure, then the parasympathetic, sympathetic, and pain cycle comes into balance. What the heck is craniosacral therapy anyway? Some people have some trouble pronouncing that. It's a mouthful, craniosacral. It is often, I'm often met on the street when people ask me what I do with kind of some blank stares. Some people have heard of it and some people haven't, but it's most of the time that when I come across somebody, they've never heard of it. So I'm going to give some basics of it, but it will not be the detail that I might give or hear from an instructor in a craniosacral course. I just want you to understand that. It's a very gentle manual therapy with osteopathic roots. It was developed by osteopath Dr. John Upledger in the 1970s. There are other schools of craniosacral therapy out there. Dr. Upledger is credited with really starting it. He was a researcher in Michigan, at Michigan State, and he was a conventional doctor, an osteopath, But he started, there are a lot of stories about Dr. Upledger, but he put this work in non-osteopaths' hands because he was overwhelmed with the number of children with autism that he was treating. And so he taught their caregivers how to do this. From there, it spun into a worldwide educational system for body workers. And now when I go to TA, it's not just body workers like massage therapists who are taking these courses, but the caliber of the student is really increasing. And we have physical therapists, occupational therapists, physicians, naturopaths, chiropractors. I was in a class one time where we had an ER doctor, which was really quite amazing. So I give all of those fields a lot of credit for picking up craniosacral therapy. The Upledger Institute's website defines craniosacral therapy as thus. Craniosacral therapy, CST, is a gentle hands-on method of evaluating and enhancing the functioning of a physiological body system called the craniosacral system, comprised of the membranes and cerebral spinal fluid that surround and protect the brain and spinal cord. I want to reiterate, surround and protect the brain and spinal cord. I'd also like to add that it facilitates functional improvement of the central nervous system and encourages the release of strain patterns or restrictions found in the connective tissues that might be impairing the central nervous system. Connective tissues in this regard could be pretty much anything. And in Ehlers-Danlos Syndrome, when we talk about connective tissues, we're talking about all connective tissues because collagen is the problem. Collagen occurs in all connective tissues. I've come to see connective tissues as different densities of fascia, meaning that bone and skin are all different densities of the same material. They become specialized the denser they get, or if they have particular functions like organs. But I have started to see them as different densities or processes of the same stuff for the most part. Remember that the central nervous system controls the autonomic nervous system. So if there is a strain pattern affecting the central nervous system, it may also be interrupting the autonomic nervous system. It is this central nervous system area that the craniosacral therapist works with. So if we have a strain pattern that's in connective tissue, it could be any source of injury. So it could occur at your birth. It could occur when you fall off your bicycle when you're 5 years old. So a little injury. The other injuries that occur in your lifetime could be a number of different illnesses, including bacterial illnesses. In Connecticut, that would include Lyme would be a big one. And any surgeries you might have for any reason at all can introduce strain patterning in the tissue of the body. It can be in any location. We can have a strain pattern in the bones, in the organs, in the nervous system, in the soft tissues, in the joints, and around any of these things as well. And they can be in any kind of direction or have any kind of characteristic. There could be a compression, there can be torsions, there can be rotations, infold, where the tissue sort of folds in on itself like a telescope would, or shearing. These are just a few examples. They can be large or tiny. So think large, scoliosis, tiny, the teeny micro tears that a lot of people with EDS walk around with all the time as our muscles work extremely hard to keep our joints together because of ligament laxity. We have this relationship here. It's a codependent, that's the word I was looking for, codependent relationship of strain pattern, autonomic nervous system dysregulation, and pain. We introduce craniosacral therapy, and it breaks up that codependency. So my job as a cranial practitioner is to find the strain patterns and offer the body an opportunity through gentle touch to reorganize. Most of the treatment takes place between the hips and the head, or the head and the hips, or the cranium and the sacrum, craniosacral therapy. Focus is on the structure and function of the craniosacral system. Some of the anatomy of that system includes the dura and the cerebral spinal fluid, bones, ligaments, tendons, muscles, and of course the nervous tissue that are also part of these structures. The rest of the body, if there's a strain pattern in a shoulder, it can lead right into the vertebrae, which is attached to the dura, which is covering the spinal cord. So something farther away from the central nervous system can impact it as well. Craniosacral system has an independent physiological rhythm. We call it the craniosacral rhythm. It's a phase of internal and external rotation of the body as it responds to slight internal central nervous system pressure differentials. There's tiny bits of pressure change as cerebral spinal fluid is produced and absorbed. And we feel that that tiny little pressure change translates into the rest of the body. It is measurable. Dr. Upledger has done a number of studies, and it is a measurable system independent of all other rhythms in the body. And it has a cycle of about 6 to 10 or 6 to 12 cycles per minute. Depends on what resource you're looking at. I've seen it written both ways in different books. And discrepancies in the symmetry, quality, amplitude, and the rate of the rhythm helps us assess the strain patterns or the restrictions in the body. So this is how I find where these strain patterns or restrictions are in the body. I use this craniosacral rhythm to help me. Actually, I use the rhythm to help me find where the discrepancies are in that symmetry, quality, amplitude, and rate. The dural membrane system itself, the dura, is continuous. It's a continuous connective membrane that extends from the head to the tailbone, surrounds the brain, surrounds the spinal cord, and anchors in the tailbone. Here's a little image. At the top, you can see that there's bone, okay? But the dura itself is sometimes also called the meninges. You may have heard of that. It's 3 layers of specialized connective tissue. In the blue layer, we have the dura mater, which is the layer closest to the bone, and it's pretty tough. The arachnoid layer, which is the middle layer, holds the cerebral spinal fluid, and it's a little spongy. Those strands in that orange part are called trabeculae. And for some people with EDS, those trabeculae can collapse and cause arachnoiditis or adhesive arachnoiditis. Those trabeculae are quite collagenous. And a little teeny tiny green line is pia mater, which is closest to the brain, and it is quite delicate. And then in that speckly part, that's the representation for the brain. On the spine itself, the dura partially follows all of the spinal nerve roots as they exit the spinal cord. And the orange layer in this slide is representative of the dura mater, the layer closest to the bones. And as you can see, that orange layer comes out with the spinal nerve roots, which are those strands that are leaving the center of the picture. The dura also develops and surrounds the left and right and top and bottom divisions of the brain. So it is during embryonic development, it is the part of the body that forms all the folds or the separations between the left and right and top and bottom of the brain. Where those are infolded are big sinuses that are the main drains of the cerebral spinal fluid and blood out of the brain back into the circulatory system. I'm not going to go into detail on those. The dura surrounds, protects, and supports the brain stem and the cranial nerves. There are 12 pair of cranial nerves, which means, there we go, that there are 24 cranial nerves altogether, 12 on each side of the body, all arising from the brain stem. Each controls its own thing, but they cover all the special senses and special organs of our brain, like our eyes and nose and that kind of thing. It is the essence of the autonomic nervous system. It is cradled within the dura in the skull. Remember, the dura is something that's important to us craniosacral therapists. We want to know if there's strain pattern in it. Brainstem is hugged by the cerebellum. So the two lobes of the cerebellum, left and right, kind of are around either side of the brainstem. And it's a transition organ. It's a very important structure. But in a nutshell, it's a transition organ between the brain itself and the spinal cord. It ends at the foramen magnum, or the opening in the skull, and the spinal cord begins where it ends at the foramen magnum. And it is supported on all sides by connective tissue, i.e. the dura. Of those cranial nerves, the vagus nerve is the primary autonomic nervous system in the body. It is also cranial nerve 10. So all the cranial nerves are numbered 1 through 12. It is both a motor and a sensory nerve. It processes and responds to stimuli. So if you touch the hot stove, it's the nerve system and the vagus that's going to tell you take your hand off of that stove, and the vagus will also be the one to teach you maybe you don't want to do that again. There are other stimuli the vagus handles as well, including trauma and pain, other types of pain. There is a very interesting theory out there called the Polyvagal Theory, developed by Stephen Porges, that I recommend people to know about it. And it talks about really the more intricate processes of how vagus nerve works. The name vagus is derived from Latin for wanderer. It's the longest nerve in the body. It innervates all of the organs. It arises from the brainstem. It, quote unquote, punches through the dura. It kind of has to pass through the dura and then leaves the skull through the jugular foramen, which is a hole between two cranial bones. It's just a little tiny space, and vagus isn't the only thing that goes through that space. And then it descends and branches prolifically throughout the body. The cranial bones have relationships. Remember, this is craniosacral therapy we're talking about. So I get my hands on heads all the time. So cranial bones have relationships. They have a relationship to each other. They have a relationship to the dura. They have a relationship to the nerves, to the brain, to blood, to the cerebral spinal fluid. All of these things together make a nice big family. If there is a strain pattern of the skull, of the skull bones or the dura, it can place undue strain on the cranial nerves and then interfere with structural relationships, signaling, and information modulation. So in the dura, if there's even a tiny little stretch or torsion or compression somewhere in that tissue, that may interfere with how the nerves are going to respond. I am really interested in restoring relationships. Contact is very, very, very gentle with the body. We typically will say 5 grams or less. So it's just enough to make contact and add enough contact to make change in the body. We really only need about 5 grams to do that of pressure. We support and follow the tissue and then guide it through its restrictions toward its release. Usually tends to correct itself with just a little bit of support. I do lots of following, put my hands on the body and I allow the tissue to move where it wants to go. We call that an indirect technique. So with my hands on the cranium, I'm either on the top or bottom of the skull, which is like the forehead or the back of the head, or on either side. Sometimes I have 2 hands, either at the back of the skull or at the forehead of the skull, or around the ears, as you see maybe in this picture. Pretty standard position for hands. We have a 2-step intention doing this kind of cranial work. It's to release any strain patterns between the bones in the suture lines and to release strain patterns of the dura. Doing this improves the space for the cranial nerves, vagus, and pain modulating centers of the brain. Improves the environment for the autonomic nervous system. Improves cerebral spinal fluid circulation. Improves waste and nutrient exchange. We don't really want to exchange waste. We just want to exchange nutrients and oxygen, all that good stuff, and get rid of waste. So it gets rid of the waste and exchanges all the good stuff. Improves central nervous system function. So we improve the structure, improve the function. For the spinal dura, we can also gently mobilize the dura, which can improve the environment of the spinal nerves as they exit the spinal cord. The spinal nerves leave the spine and form the peripheral nervous system, innervating muscles of the limbs, the reproductive organs, and the elimination organs. So the overall result now is that we have an improved central nervous system health, improved autonomic nervous system health, better innervation of peripheral nerves, and my personal finding through this craniosacral therapy with Ehlers-Danlos Syndrome in particular is improved proprioception and fascial tone. So where we have really lax fascia and very poor proprioception and balance, craniosacral therapy can help to stabilize those. Now we do have to consider a few things because the person with Ehlers-Danlos Syndrome is a little wobbly. The joints are more mobile and unstable. There can be multiple neurological conditions that exist that may defer CS treatment. With some conditions you don't want to have craniosacral therapy with. So always, always discuss your medical history with your CS practitioner. And as we know, all of us firsthand, not all craniosacral therapists will know about Ehlers-Danlos Syndrome. Some will and some will not. So if you're going to look for a craniosacral therapist, look for one who has some experience, who's familiar with Ehlers-Danlos Syndrome, and most importantly, curious to learn. You can reach out to the Upledger Institute through their website to look for a therapist if you want to. They are not really, can't really find out through that website if they know anything about EDS, but you can reach out to them and talk to them about it. And I'm also always available to talk to anybody who wants to talk to me. A quickie little summary. We reviewed that pain and the autonomic nervous system have a reciprocal relationship. And the autonomic nervous system is part of the central nervous system, which is what craniosacral therapy works with significantly. That strain patterns in the body can interrupt the autonomic nervous system, and that craniosacral therapy reduces the strain patterns in the body, which may help the autonomic nervous system reestablish self-regulation by improving structure and function. This pretty much brings me to the end of my presentation, which was shorter than I was expecting it to be, which means that there's lots of time for Q&A. But as a quick aside, here are a couple of resources. I mentioned them earlier. The Facebook group, if you're in Connecticut or any of our bordering states, you can request to join the CT Zebras, Ehlers-Danlos, and CTD support group. Look for the two zebras with the blue flames. The other resource is also Facebook. It's EDS and CTD's Coalition of Health and Wellness Practitioners. And if you're curious, Dr. Upledge wrote a book a long time ago called Your Inner Physician in You, which is a really nice, short, easy to read book about craniosacral therapy. It has a lot of stories in it, and you can get it through Upledger, which would be great, but also Amazon and Thrift Books. I found it. And I really want to thank everybody for listening and attending. And I hope I gave you a little bit of an overview of craniosacral therapy and why and how it can address the autonomic nervous system and pain responses in the body. And I can be reached at this slide anytime. So thank you.
Thank you, Eloise. That was really a very informative. I didn't even know that this terminology, this therapy was available, but knowing more about it and how it can relate to releasing pain or improving pain in people with EDS and other similar type of conditions, I think is very valuable for all of us to know. So thank you very much for the presentation. And there are a few questions here, so feel free to go to the Q&A and we'll answer those verbally.
Okay. All right, so I'll do my best. I'm just going to start at the top. They're probably, oh, they do come in chronological order. Okay, good. So this is from E. Matthews. The question is, how can CST help with CSF pressure and flow troubles? That's going to depend on why you're having CSF pressure and flow troubles. But if it's not an uncontrollable intracranial hypertension problem where you need to be shunted, the opening up of the sinuses and the dura can help drain the CSF out of the brain. And I don't mean that in a bad way. It needs to circulate. It can't be getting backed up in there. So it can help regulate that pressure by helping the drainage pathways have freedom. If there are these torsion patterns around any of those, it could maybe slow down that flow. I hope that answered the question. I'm going to move on to the next one. The question is from Catherine Schultz. What should one look for in a good craniosacral therapy practitioner? You would really want to have somebody who's had some experience as a craniosacral therapist. There are certification programs or processes that some of them go through. That if they're not certified, that doesn't mean they're not a good therapist, though. So I want you to know that you can find a really great therapist with great hands and great knowledge who isn't certified. A craniosacral practitioner does not have to be certified to practice. So, but you'd want to look for one that's been around for a while, and most importantly, one that is willing to learn about Ehlers-Danlos Syndrome and the comorbidities that go along with it. Courtney asks if I can recommend anyone in Charlotte. I cannot. I'm really sorry. If you go to the website for Upledger, you can search for someone in your area. So that's www.upledger.com, and there's a button in there somewhere, find a therapist, I think, and you put in your area, and you choose the modality of craniosacral therapy, because there are other modalities listed, and look for someone near you, and then just reach out to them and talk to them. So the Modani protocol is a really great protocol. It's fantastic for building muscle and improving balance, reducing POTS, I'm sure, if you can improve your muscle tone. And craniosacral therapy, in this situation, if you're feeling good physically, can help with the brain function. So if you're still feeling kind of foggy-headed or anxious or anything like that, craniosacral therapy might help you balance that. In so doing, then other therapies should go a lot more smoothly, and you could accelerate through them. It won't feel as daunting to go through things. And Liz, I'll refer for a craniosacral therapist, look at upledger.com. Catherine asks about, is CST replacing a chiropractor? It does not replace it. It can definitely be complementary. If you are seeing a chiropractor, it's recommended that you see somebody who's very gentle without any high velocity adjustments. Craniosacral therapy is very different than chiropractic. The sessions are about an hour long. They're very, very, very peaceful. Most people are very relaxed. So that's different than going to the chiropractor and having your 10 or 15 minute session and getting your adjustment and walking out the door. But it is a nice adjunctive therapy. So both of them are. The difference between craniosacral and osteopathic manual manipulation or osteopathic therapy, not much, Amanda. The difference there is in certification and the medical model here in the United States for that. And Dr. Upledger was an osteopath, an OMT, an OMM, and so he modified the techniques of osteopathy and gave it to people who were not osteopaths, and that is where we are today. So the difference here is that I can't make a medical diagnosis for anybody, but my techniques are going to be very similar. I see a cranial osteopath almost every month, and he helps set me straight again, but his sessions aren't nearly as relaxing. They're just get in and make the adjustments and head out the door, even though his sessions are about an hour long. Marie Christian, I would recommend that if you find somebody near you, actually through the Upledger website, that you just ask them if they are familiar. The awareness is increasing, but there's still a lot that needs to be done. Han Rachel asks, can you explain how you release strain patterns of the dura by manual gentle touch, since the dura mater is so deep? What about everything superficial to the dura, like the skin, all fascial layers, and the muscles? So let me touch, that's a really great question. Let me talk first about the dura. The dura mater, that part that's closest to the bone, is adhered to and interwoven with the periosteal layer of the cranial bones. So when I place my hands on the skull, I am in indirect but direct contact with the dura itself. A lot of it is very delicate palpation skills that are developed over many years of practice. And everything superficial to the dura, like the skin, all the fascial layers and the muscles, we just understand that we're working through those and into the dura. I hope that answered your question. That's a question that comes up even in class. So it takes practice to get there, but we can get there. Susan Whitehead, I am sorry, I'm not going over specific techniques for cervical or thoracic, but we do have specific cervical and thoracic techniques. For the cervical spine, under good conditions where there isn't craniocervical instability, we have techniques that help to release the occiput from C1. And for thoracic outlet syndromes or thoracic issues, we use diaphragm, transverse diaphragm technique, which is a sandwiching of, I sandwich the body between my hands. So one hand would be on your sternum and clavicles, and the other is under your upper thoracics and C7. And I apply very, very gentle pressure into the tissue. And the tissue will then kind of start to relax and engage with me after a little bit of time in pressure. And it will self-correct through indirect techniques. And indirect is that process of just following tissue instead of forcing tissue to go in some direction I think it's supposed to go. I don't know what direction tissue might want to go, so I allow it to lead me. By doing so, it tends to correct itself. I'm just there for support and a little egging on to some degree, because I might follow it and then give it a little nudge. And Ehlers-Danlos bodies, we are very careful with those little tiny nudges. 5 grams of pressure is about the weight of a nickel. So this pressure I'm talking about is about what I need to move a leaf over top of water. And even though that's very light, it's very therapeutic and very effective. Megan asks, does craniosacral therapy improve lymphatic system function? Yes, it does. Indirectly, but yes. And you can also see a lymphatic drainage specialist. E. Matthews, sure, yeah, you could use feedback loop. The question is reciprocal relationships influencing one another, influencing each other. Would you say another way to express that is a feedback loop? That's a good question, and that could be another way of saying it, yes. Amanda asks, if I have a craniosacral adjustment, what holds the adjustment from just going back to how it was when I leave the office? My OMM adjustments wouldn't hold for days. With PT, I do all the craniosacral exercises every other day that are part of Muldowney. So things stay pretty together. Thanks so much for your presentation and dedication. Well, I think that that's a good question. What would keep it from, what keeps it held together? Part of that's going to be working in physical therapy and biomechanics, and that will help the craniosacral therapy treatments stay. But I have found over time, if the person can come regularly, that the tone of the connective tissue improves with craniosacral therapy. Angela asks, what is different in your approach to EDS and POTS versus other disorders? What protocols did you find useful? So I do have technique adaptations. I don't use as much pressure when I work with people with Ehlers-Danlos Syndrome, and I eliminate certain techniques to protect the cervical spine from any undue stress. With POTS disorders, if a client comes in and they have POTS, I will be very careful about letting them sit up on the table. So we do that very, very, very slowly. It does tend to get better though with craniosacral therapy. It can take some time, and I never ever suggest that people quit doing anything else that is helping them, as like medicines, if that's helpful, and exercise. Angela also says, I've taken CS1 and 2 and somato-emotional release. High five, Angela. I have a study group on Sunday. In your experience, Catherine asks, how long do patients feel the positive effects of CST? From massage or chiropractic treatments, my relief lasts no longer than a day. It depends on the person. It depends on why you're in, and it depends on the depths of the issues you're dealing with. So most people, though, will find relief for 3, 4, 5, 6, 7 days sometimes, 3 to 7 days. On occasion, I've had it longer. What tends to happen is the first couple of visits, maybe 4 to 5 days. If you can continue to go, then the benefits last longer and longer. And so your appointment frequency can be spread out. Kim asks, are you familiar with the technique called counter strain? I'm interested to know the difference or relationship between CST and counter strain. I've heard of counter strain, Kim. I am not very well versed in it. I know there are some similarities. I know that Jones created it, but there is a slight difference, I believe, in just the practicality of it with Upledger's work and the intention of Upledger's work. Sort of knowledge. Heather asks or mentions, one issue I have with some practitioners is they are not aware of how important the alignment of the upper cervical region is. For example, I saw a PT this week who dry needled my neck for a whole hour but did not address C1 and C2 misalignments. So she actually did not help my pain or dysfunction at all. I had to visit a chiropractor later as an emergency and he fixed it. How can we as patients determine whether a practitioner can adjust those levels? Is there a certain phrase or jargon we should be using? Just so you know, craniosacral therapists do not directly adjust C1 and C2. You need to see somebody else for that, an OMT, an OMM, or a chiropractor. Speaking up at your appointments and advocating for yourself and educating all of your practitioners is the very best way to get them to understand. As far as jargons or phrases go for craniosacral therapists, you could try saying occipital cranial base or the OCB, occipital cranial junction. I'm sorry, occipital cranial base is OCB. Had it in my head one way, trying to say it a different way. As that would be the best, is to say that sometimes you feel jammed there or out of alignment. But even though we have techniques to address it, we don't do a direct adjustments. They're always indirect adjustments if we're going to do them. How can craniosacral therapy help with tinnitus? It depends on why you have tinnitus. The nerves that work with hearing go through the temporal bones, and the temporal bones are on the side of the head. And sometimes if they're out of alignment or they're jammed, it will cause problems in those nerves. So having an assessment to see if there's anything jammed or locked up in those bones, if those can be freed, then the tinnitus may self-correct. But I don't know for sure unless I knew for sure what the tinnitus was from. The tinnitus from nerve damage, like if you're a musician and you actually had nerve damage, may not be helped with craniosacral therapy. Anonymous asks, can you get craniosacral therapy if you have neck instability? Yes, but you want to talk to your practitioner, you want to tell them your neck is unstable, and they will stay away from it, or they'll modify their technique. Amanda mentions thought chiropractic was contraindicated for EDS. Depends on the chiropractic. The high velocity, high force adjustments are contraindicated, but there are other types of chiropractic that are very beneficial and almost no impact at all. My personal position on that is when we are out of alignment, the nerves and the veins and the tissues are all being stretched and torsioned out also. And if they're out, then they won't function as well. And if you can get them back to be in alignment, if the bones can be in alignment and then those nerves and blood vessels can also become aligned, then it can reduce pain and restore function. But I would strongly caution what type of chiropractic you get. Liz asks, is low pregnenolone related to problems that craniosacral therapy can help? I'm not sure. I'm not really familiar with that. Do you mean, I don't want to guess. I would, as a practitioner, I would ask my client to educate me on that, and then we would talk about it. Craniosacral therapy addresses so much in the body that it very well might be helpful. Susan asks, should you go through an entire session, a CST session for someone with EDS, or confine it to a specific area of need? Example, cervical area. That depends on the session and the client and what you're dealing with on that particular day. So one appointment, you might have a full session, and another appointment might be a little bit more focused on the cervical area if you need it. But it's not the same thing as massage therapy, where you can go in and say, I need my shoulder work done, and they can do that for an hour. In craniosacral therapy, sometimes we find that those strain patterns are further away from the area that's causing or is feeling the most problematic. And so we want to address the whole body to find out if there's a strain pattern somewhere else in the body that's the primary reason. Michaela Stager, what's my favorite thing about craniosacral therapy? Michaela, by the way, is my daughter. She's in Ireland right now. My favorite thing about craniosacral therapy, frankly, two things, maybe three. I really love the anatomy of craniosacral therapy. And the other is that I really, really love working with clients and learning from my clients. My clients truly are my best teachers. I don't know how many questions are left. There's a lot. Okay, I'm going to try and get through these quick. How much should you expect to spend on a 60-minute session? Is 60 minutes appropriate? 60 minutes is appropriate. It's going to depend on the area where you're living and the experience of the therapist. I charge $110 an hour for my region and my experience, but I know others who charge much, much more than that, and others who charge much less than that. Marie says, in my area, there's someone whose modality is listed as lymph drainage therapy, neuromanipulation, and visceral manipulation. Is this what you were talking about? No, not necessarily, but it sounds like she or he were trained at the Upledger Institute or through the Upledger Institute program in one way or another, because under their umbrella of education, they have a couple of other schools that do specialize in lymph drainage, neuromanipulation, and visceral manipulation. Those are different techniques than craniosacral therapy. Megan asks, have you seen any patients use craniosacral therapy in combination to improve dry needling outcomes, as craniosacral therapy can improve fascial restrictions, making dry needling possibly more effective? Now, that's a really good question. I have a lot of clients who do get dry needling. I think together it does help, just generally speaking. They don't interfere with each other. Can CST identify and or help with spinal ankylosing processes? Many thanks. Yes, absolutely. That would be one of the few therapies that might make a huge difference. Michelle clarifies it's tinnitus from a concussion. Anything that's concussion related is appropriate for craniosacral therapy. And Anonymous says, what's the relationship between craniosacral therapy and myofascial release therapy? It's not typically as deep as myofascial release. It's also slower. It's slower, if you can imagine. Myofascial release can be slow. Craniosacral therapy is slower. Also, myofascial release is direct. You put pressure into the tissue directly, significantly as well, and you drag the tissue to comply. And in craniosacral therapy, we are not using as much pressure, and it's very gentle. And instead of forcing tissue to change, we are providing a gentle environment with slight pressure. If you just think of kind of high school physics, a little bit of pressure, a little bit of time, a little bit of heat from your hands can change the quality of the tissue itself. It kind of melts away and it can change its patterning, but without forcing it to change, it will change to the pattern that is best for you. I hope that answered a question. That was all the questions. And I'm thankful that everybody was there for that. And thanks, John, for the time for that.
Well, thank you, Eloise. That was a very comprehensive presentation, and also some very valuable questions that I think actually clarifies and makes it more real for most of us when we can see how it relates to each one of our bodies and our conditions that we have. So any final comments before we wrap up for this evening?
I'm just very, very, very thankful to you, John, for allowing me to present this information. Like I said at the beginning, this was an overview of several things coming together. So not one thing was in full finite detail. And if you want to know more, I'm happy to talk to anyone individually at any time about more. And maybe someday, John, we can do another presentation and I can go into more detail, or practice protocols or protocol adaptations specifically for people with collagen disorders. So I look forward to trying that too.
Okay.
Yeah.
Well, I would hope that our audience would, you have her website, you have her email address, so please get back to Eloise and suggest to her what topics you might want to have. She's receptive to do another presentation, and this is a very valuable area that all of our EDS members really need, that is pain management. So with that said, I'm going to thank all of you for being here this evening, and Eloise for your insightful presentation. And again, the recording will be posted on our site along with the slides in the next couple of days. Please share it. Feel free to take that link and share it out on your Facebook sites with your groups or your peers, so that more people can learn about this very, very valuable service that is available. So with that said, I'm going to wrap it up for the evening, and thank you for joining us.
Thanks, John.
Have a good evening. Bye-bye.
Bye-bye.